Hi, I'm Nurse Cindy, and this is my patient, and we're going to conduct a physical exam for nursing 309. May I have your permission to do this exam on you today?
Yes, you may.
Thank you. I'm going to wash my hands with Purell. And we're going to start off with an inspection of your hands today. I see lots of calluses. You must be a hard worker. And we're checking your nails for capillary refill and clubbing. And there is no clubbing, and there's good capillary refill on all of the fingertips. No clubbing on the right hand. Great. I don't see any nodules on the knuckles. Everything is in good alignment. Palpating the knuckles, everything looks good. Okay, we're going to check your skin turgor. I don't see any tenting on the forearm. Okay. And overall, your skin looks good, your color looks good. Next thing we're going to check is your radial pulses on the inside of your wrist, right here. The radial pulses are right there. And I palpate a good regular pulse on this one and this one. Okay. Next we're going to check the range of motion of your hands. I'd like you to move your hands up and down like that. And move your fingers up and down, just your fingers. And I'd like you to move your hands like this. I don't see any ulnar problems. And I'd like you to spread your fingers and then make a fist. Excellent. Okay, I'd like to check your hand grips. There we go, nice and strong. And next is your arms. I'd like you to flex your arms, which means that you go like this. Yep, other arm. And this is flex, and this is extend. Okay, can you do that equally on both arms?
Yep.
Flex and extend. Strength. So while I'm pushing here, you pull, you push. There, good strength. Again, extension strength. Okay, let's check your flexion strength. You pull up, and I'm going to resist, okay? There we go. Okay, I'm going to resist, you pull up. Good. Good and strong. Next, we're going to do the shoulder flexion and extension. So flexion is you go up like that, flex on both sides, and extend both sides. Excellent. And this is abduction. I'd like you to extend, abduct like that. And this is adduction, where you go across like that. Full range of motion. Okay. This, we're going to check your rotation, so I'd like you to go up like this, and then back down like that. Okay. Let me check your extension again. Come back like that. Just bend your elbow a little bit. So it's like this.
Oh.
Yeah, excellent. Okay. Next thing we're going to do is I'm going to have you rotate your head side to side, and good range of motion. Let's check your strength. You try to rotate up against me. Try push and push. Good. And I'd like you to shrug your shoulders. Great. Okay. Okay, so next we're going to examine the skin on your face. I don't see any problems. I don't see any acne. I don't see any issues. We're going to check the hair distribution and growth. We have some, some everything looks good. Okay, the skull is symmetrical. The face is symmetrical. I'd like you to smile. We're going to check for symmetry. This is cranial nerve number 7. Excellent. We're going to check the temporal artery. So the temporal artery is right here, right in front of the ear. And I don't feel any abnormal pulsations. Feels good. Next we're going to check is the TMJ joint, which is right where the jaw is, and I'd like you to open your mouth. Good. It's operating smoothly, and I'd like you to do like that with your jaw. Great. I don't hear any snaps, clicks, or feel any crepitus. Okay, so we're going to check your eyes now. We're going to test your movements of your muscles on your eyes. So I'd like you to look at me and look where I'm pointing my finger. So that's one position, second position, third position, fourth position up here. Can you see my finger?
Yeah.
5 and 6. Okay, so you're moving your eyes very well. We're checking the corneal light reflex. So I'm going to shine the pen light towards the bridge of your nose. And I see equal light in his eyes, equal reflection. I'm going to check your pupils, size, response to light, and accommodation. So, starting with how they look, they're about 3 centimeters right now. As I shine the light, that one goes down to about 2 centimeters. And this one here, this is about 3 centimeters also, according to my little scale. And as I shine the light, it goes down to 2 centimeters. Okay. And as I bring my finger towards the bridge of your nose, what I should see are your pupils changing size. So I'd like you to look at my finger. Here we go. And the pupils get slightly smaller. So his pupils are equal and reactive to light and accommodation. Next, we're going to inspect the eyebrows, the whites of the eyes, and the eyelids, the conjunctiva, and I don't see any redness or swelling, any discharge. Everything is pink, sclera are white, everything looks like it should. So we're going to check your ears now. I'd like to make sure that everything is the way it should look. This is the tagus, this is the external ear. Everything looks fine on both sides. Okay. We're going to make sure that everything moves the way it should. Does anything hurt, Eric?
No.
Good. Okay, great. And I'm going to test your hearing. So I'd like you to plug your right ear, and I'm going to whisper something into your left ear.
Yeah.
What did I say?
I'm not sure. Do that again. A.
Correct?
B. F.
Perfect. I'm going to do the same thing on the right ear. Okay. Plug your left ear.
D. A. 10.
Excellent. Good hearing in both ears. Okay, so next we're going to check your nose. We're going to inspect. Everything looks patent. I don't see a deviated septum. We're going to have you plug one side of your nose and blow forcefully through the other nostril, okay?
You sure you want me to do that?
Well, don't blow too forcefully.
Okay.
Okay. Yep, no problem breathing?
No.
Okay. Other side? Excellent. Okay, so next we're going to inspect your mouth and throat. We're going to use a pen light, and what I'm checking are the insides of your cheeks and gums. Okay, so I'd like you to open your mouth. Everything looks pink, good. I see a uvula and you have tonsils, right?
Yeah.
Okay. I see tonsils. I'd like you to open your mouth again and say ah.
Ah. Ah.
Okay, uvula rises midline. And I'd like you to check, stick out your tongue, and we're going to check that it is midline and doesn't have any tremors. Everything moves okay, right?
Yeah.
Okay. So now we're going to inspect your neck for symmetry, no lesions. We're going to check for any enlarged lymph nodes. So I'm starting here, right in front of the ear, going around behind, and then I palpate right under the chin and over the jaw, and then down through the cervical area, back behind the sternal muscles here, and then the supraclavicle. I don't feel any lymph nodes or any large swellings or anything. Okay, so we're going to check for the carotid pulse right around here. I don't see any swelling. I do feel it. Okay, and then on the other side. Excellent. Okay, and I'm going to listen for the carotid pulse. I'm listening for a swishing sound called a bruit with the bell of my stethoscope. In 3 spots. Okay, and this side. All right. Everything sounds good. We're going to palpate the location of the trachea, which should be midline, and it is. Okay. Then I'd like to check the range of motion of your neck, so I'd like you to go chin to chest, and then raise up. Okay, ear to shoulder, and then turn your head from side to side. Excellent. Good. So now I'm going to move to the back of your throat and palpate your thyroid gland. And I'm going to start right back here. I'd like you to put your head up a little bit. And I'd like you to look to the right side. And I don't feel anything. And now as you drink a glass of water, I should feel your throat move evenly. So I'd like you to just take a sip of water with your okay, good. So now we're going to do the other side. I'd like you to look to the left. Okay. Don't palpate anything. Normally you can't palpate the thyroid. So I'd like you to take another sip of water, and I'm going to feel your throat as you take a sip. And it feels like it should. Symmetrical on both sides. The skin condition is good. His posterior anterior diameter has that 5 to 7 ratio, which is normal, so he doesn't have any kind of a barrel chest. Let me see. Shoulders are symmetrical, muscles are symmetrical. We're going to palpate this symmetric expansion, so I'm going to put my fingers here and bunch up a little bit of skin here, and I'd like you to take a nice deep breath there. Good, and what I see is my thumbs moving out. Next we're going to do tactile fremitus, so I'm going to start with my palm in this position. I'd like you to say 99.
99.
Good. Again.
99.
Okay. One more time.
99.
Again.
99.
Again.
99.
Again.
99.
Okay.
99.
Okay.
99.
One more time.
99.
And one more time.
99.
Good. So we found that in 5 points. We're going to check the spinal process, starting here with C7. Vertebrae 1 through 7 here. Everything is even. No bulges all the way down through T12. And then the lumbar vertebrae are all in alignment, 1 through 5. Okay, we're going to percuss the CVA angle. CVA, no any tenderness. Any tenderness?
No.
Okay, how about on that side?
That side's fine.
Okay. Now we're going to listen to the breath sounds. I'd like you to take a nice deep breath. Okay, again. 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 One more time. Again. Okay. And then around to the side. The lobes, lower lobes. Okay, great. Okay, so the skin all looks good and clear and clean. No lesions or moles that I can see. He's breathing evenly. We're going to listen to his breath sounds right here, starting up here. Take a nice deep breath. Okay. Okay. Very good. Nice clear lungs, no adventitious sounds. I'm going to have you lean forward, Eric, and let the breath out. Take a deep breath, let the breath out. Lean forward, and I'm going to listen at the apex of your heart for a murmur, okay? With my bell. There you go. Okay, great. I don't hear anything unusual other than a good S1 and S2. And turn his head to the other side, so look over there. And I don't see any pulsing or bounding. And have you come over and look over this side now. Great. Okay, everything looks good. I'm going to look at your heart for pulsations that are, out of the unusual, and I don't see anything unusual. And we're going to listen with the diagram S1, S2 in 4 spots. Okay, good. Listen with the bell of the stethoscope at the apex of the heart. We're listening for a murmur, and I hear none. Okay. Okay, so we're moving on to the abdomen and hips. What I'd like to do is first listen to your bowel sounds in all 4 quadrants. So I'd like you to lay down again. And starting with the left lower quadrant, the right lower quadrant. Listening. All the bowel sounds are normal active. The corrector sounds over aorta and renal arteries, which are slightly above the umbilicus, with the bell at the stethoscope. Okay. We're going to percuss in 3 spots in each of the 4 quadrants. What I hear is good to panic dullness. Okay, excellent. We're going to lightly palpate each of the 4 quadrants for masses or tenderness. Do you have any tenderness anywhere?
No.
Okay. behind the left mid-axillary line, and I don't palpate anything. I don't palpate any masses or anything here, anything that's hard. And the liver, though, you're able to feel the liver right a centimeter or two below the right ribs. And actually, I feel a little something, but okay. The legs are symmetrical, the feet are symmetrical, there's good distribution of hair. Let me see. He's got good pulses in his feet. The dorsalis pedis. Posterior tibial pulses are good. Good pulses. And we're going to check for pulses behind the knee, the popliteal pulses. Yep. And let's try this leg. Up. Okay. The legs and feet are cool. It's kind of cold in this room, and I don't see any edema in the legs or feet anywhere. Next, we're going to do range of motion in the hips. So I'd like you to raise up your legs straight, nice and straight. Good. Okay. So now we're going to put your leg out to the side. See how you move out to the side. Good. And bring it in. Bring this leg in. Let's see how you move that way. Good. Okay, let's do the other leg. Same thing, straight leg raise. Okay. Push this leg out to the side and then bring it in. Great. Okay. So now we're going to test muscle strength. I'd like you to do the same thing with your leg up. I want to push up against you, and you try to push my hand up. Good. Okay, good. And let's see, say you, I want you to push against me and push your leg out. Good, and then bring it in, push against me in. Okay, so again, I'd like you to try to lift my hand, right? Okay, and then I'd like you to push out against my hand, and then push in against my hand. Good, so you've got good muscle strength in your hips. Okay, so with the feet, I'd like you to flex and extend your feet. Flex, extend, okay. And I'd like you to move your feet out like this. Yeah, okay. Okay, so now we're going to test your muscle strength. So I'd like you to try to push against my hands. And we've got good muscle strength there. And push, good muscle strength there. Okay. So now I'd like you to sit up, please, and we're going to proceed with a neurological exam. So I'd like you to face the camera. We're going to get a cotton ball and check the sensation in your feet. We're going to check your face. Can you feel that?
Yep.
Okay. Does it feel soft?
Soft.
Okay. Great. How about here?
Soft.
Okay. Can you feel everything?
Yep. Soft everywhere.
Okay.
Soft, soft, soft.
We're going to test the sensation of your hands and legs and feet using a sharp and dull end of a Q-tip. So when I touch you, I want you to say either sharp or dull, okay?
Okay.
All right.
Soft. Sharp.
Okay, that's right.
Soft. Sharp.
Soft.
Sharp.
Okay.
Soft. Sharp. Soft. Sharp.
So keep your eyes closed. What's that?
That's a cotton ball.
Okay. And what's this?
Scissors.
Right. And what's this?
Pen.
Okay. And let's do your other hand, left hand.
Screwdriver.
Okay.
Scissors. That's a dime.
Right. Okay. Okay, so I'd like you to give me your hand, and I'm going to test to see if you have good position sense in your fingers, okay? So I'd like you to tell me if I'm moving your finger
Should I have my eyes closed?
up or down. Yeah. Okay, close your eyes. Good. So,
Up.
okay.
Down. Up.
Okay, good. Other hand.
Up. Down. Up.
Okay, good. Now I'd like you to put your hands on your legs, and we're going to see if you can do the rapid hand movements. Yep, you passed that one. Next, I'd like to see if you can move your heel up and down your shin on either one of your legs. Okay? Okay, great. Good. Good reflex on that side. Oh, really good reflex on that side. Okay, thank you. Okay. So the next thing I'd like you to try is walk over there with heel to toe, like you're walking on a straight line. Okay. Can you walk on your toes for a few steps and then walk on your heels?
Yeah. Heels.
Okay, good. So now what I'd like you to do is stand in one spot and close your eyes. We're checking your balance. You could stand on both legs.
Oh.
Good balance. Okay. And now we're going to check the range of motion of your spine. I'd like you to bend forward. Just bend forward like you're going to touch your toes. Okay, and then back. And I'd like you to hyperextend your back like this. A little bit. Okay. And I'd like you to bend from side to side like this. Okay. And twist from side to side. Okay. That's all. Thank you very much.
Thank you.